Analysis of the 2010 U.S. Census data reveals huge changes over the last 20 years. The U.S. population is bigger, older, more Hispanic and Asian, and less inclined towards marriage and traditional families than it was in 1990. Other trends reveal that the United States is more embracing of several generations living under one roof, more inclusive of same-sex couples, more aware of multiracial identities, more suburban, and less rural. The essential knowledge and skills for understanding cultural diversity and providing thoughtful, person-centered, culturally respectful care have become essential components of nursing practice. So in this lecture, we're going to focus on the concepts of cultural diversity and cultural respect and discuss their influence on nursing care. Cultural diversity is the coexistence of different ethnic, sex assigned at birth, racial, and socioeconomic groups within one social unit. These groups include, but aren't limited to, people of varying religion, language, physical size, sexual orientation, age, disability, occupational status, and geographic location. Nurses must be sensitive to cultural factors in order to provide culturally respectful care to people from diverse backgrounds. The concept of cultural respect enables nurses to deliver services that are respectful of and responsive to the health beliefs, practices, and cultural and linguistic needs of diverse patients. Moreover, cultural respect is critical to reducing health disparities and improving access to high-quality health care. Culture is a shared system of beliefs, values, and behavioral expectations that provides social structure for daily living. The National Institute of Health defines culture as the combination of a body of knowledge, a body of belief, and a body of behavior. Elements include personal identification, language, thoughts, communications, actions, customs, beliefs, values, and institutions that are specific to ethnic, racial, religious, geographic, or social groups. Nurses need to keep in mind that these elements influence beliefs and belief systems surrounding health, healing, wellness, illness, disease, and delivery of health care. Culture influences roles and interactions with others as well as within families and communities, and is apparent in the attitudes and institutions unique to particular groups. There are several characteristics of cultures that we need to be aware of. Culture helps shape what is acceptable behavior for people in a specific group. Culture is learned by each new generation through both formal and informal life experiences, and language tends to be the primary means of transmitting culture. The practices of a particular culture often arise because of a group's social and physical environment. Cultural practices and beliefs may evolve over time, but they mainly remain constant as long as they satisfy a particular group's needs. And culture influences the way people of a group view themselves, have expectations, and behave in response to certain situations. Because a culture is made up of people, there are differences both within cultures and among cultures. Within most cultures are subcultures. A subculture is a large group of people who are members of the larger cultural group, but who have certain ethnic, occupational, or physical characteristics that are not common to the larger culture. For example, nursing is a subculture of the larger healthcare system culture, and teenagers and older adults are often regarded as subcultures of the general population in the United States. Most societies include both dominant culture groups and minority culture groups. The dominant group has the most ability to control the values and sanctions of the society. It usually is, but doesn't have to be, the largest group in the society. Minority groups usually have some physical or cultural characteristics such as race, religious beliefs, or occupation that are different from those in the dominant group. In the United States, the dominant culture is that of white, middle-class, Protestant people of Northern European descent. There are more white people here than African Americans, Latinos, Asian Americans, or Native Americans, and there are more middle-class people than there are rich or poor people. Keep in mind, however, a group does not have to be a majority to be the dominant culture. South Africa is a perfect example. In South Africa, there are 4 times as many black Africans as white Africans of European descent. Yet under a system of racial segregation and domination called apartheid, which was legally in effect from 1948 to 1991, the white population managed to hold political and economic power. South African whites thus were the dominant culture, even though they didn't have the numbers. When a minority group lives within a dominant group, many members lose the cultural characteristics that once made them different, and they may take on the values of the dominant culture. This process is called cultural assimilation or a culturalization. Wow. For example, when people immigrate and encounter a new dominant culture as they work, go to school, and learn the dominant language, they often move closer to the dominant culture. The process and the rate of assimilation are individualized. Mutual cultural assimilation also occurs when both groups taking on some characteristics of the other. For example, many Hispanic immigrants to the United States learn to speak English, and many Americans learn to cook and enjoy traditional Hispanic foods. We all gain from the many cultures with which we live. Although we seldom think about it, the clothes we wear, the foods we eat, and the music we enjoy, many of the words we use, and the leisure activities we practice are all influenced by a culturalization. A person may experience culture shock when placed in a different culture they perceive as strange. Culture shock may result in psychological discomfort or disturbances, because the patterns of behavior a person found acceptable and effective in their own culture may not be adequate or even acceptable in the new culture. Ethnicity is a sense of identification with a collective cultural group, largely based on the group members' common heritage. One belongs to a specific ethnic group or groups either through birth or through adoption of characteristics of that group. People within an ethnic group generally share unique cultural and social beliefs and behavior patterns, including language and dialect, religious practices, literature, folklore, music, political interests, food preferences, and employment patterns. Ethnicity largely develops through day-to-day life with family and friends within the community. Although the term ethnicity is often used interchangeably with race, these terms are not the same. Racial categories are typically based on specific physical characteristics such as skin pigmentation, body stature, facial features, and hair texture. Because of the significant blending of physical characteristics through the centuries, however, race has become harder to define using simple classifications, and physical characteristics are not considered a reliable way to determine a patient's race. Federal standards for race classification provide 5 categories: Native American or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, and white, and provide the opportunity for people to identify themselves in multiple categories. A variety of factors may affect a person's sensitivity to others. When one assumes that all members of a culture, ethnic group, or race act alike, stereotyping is at work. Stereotyping may be positive or negative. Negative stereotyping includes racism, ageism, and sexism. These are mistaken beliefs that certain races, an age group, or one biological sex is inherently superior to others, leading to discrimination against those considered inferior. When we hold attitudes towards people or associate stereotypes with them without our conscious knowledge, it's called implicit bias. Also affecting cultural sensitivity are cultural imposition, which is the belief that everyone else should conform to your own belief system, and cultural blindness, which occurs when one ignores differences and proceeds as though they don't exist. Cultural imposition and cultural blindness can be observed within the healthcare system, especially in regard to non-mainstream methods of care. Cultural conflict occurs when people become aware of cultural differences, feel threatened, and respond by ridiculing the beliefs and traditions of others to make themselves feel more secure about their own values. There are many cultural influences that can affect a patient's healthcare and their healthcare beliefs. So let's talk about some of them. First one is physiologic variations. Studies have shown that certain racial and ethnic groups are more prone to being diagnosed with certain diseases and conditions. For example, Native Americans are more prone to heart disease and cirrhosis of the liver, while African Americans are more prone to hypertension and sickle cell disease. Use knowledge of such risk factors when interviewing a patient to complete a health history. Keep in mind that the fact that cirrhosis of the liver and fetal alcohol syndrome are found more frequently in Native Americans and Alaska Natives does not mean that these individuals have a genetic potential for these diseases, but rather that structural racism in the United States and elsewhere has produced living circumstances that promote these disorders more frequently in these communities. Pain is another one, or the reactions to pain. Healthcare researchers have discovered that many of the expressions and behaviors exhibited by people in pain are culturally prescribed. Some cultures allow or even encourage the open expression of emotions related to pain, whereas other cultures encourage suppression of such emotions. The Asian and Amish culture generally are very stoic when it comes to expressing pain, while African Americans, Italian, and Jewish cultures tend to express their pain more openly. Mental health. Most mental health data originated in research and observation made of white middle-class people, but many ethnic groups have their own respectable patterns of behavior for psychological well-being, as well as different psychological reactions to certain situations. For example, many Hispanic people deal with problems within the family and consider it inappropriate to tell problems to a stranger. Some Chinese people consider mental illness a stigma, and seeking psychiatric help is a disgrace to the family. Assign sex roles. In some cultures, like the Muslim or the Arab cultures, the man is the dominant figure and generally make decisions for all family members. For example, if approval for medical care is needed, the man may give it regardless of which family member is involved. In male-dominant cultures, women are often passive. On the other hand, in some cultures, women are considered dominant. Language and communication. When people from another part of the world where English is not the dominant language move to the United States, they may speak their own language fluently but have difficulty speaking English. This is especially true for people in the family who do not work outside the home and for people who live in proximity to others who speak their primary language. Because the United States has such a diverse population with many languages spoken, communication problems can arise during healthcare activities. Nurses who work in a geographic area with a high population of residents who speak a language other than English should learn pertinent phrases and words in that language. Many facilities also have a qualified interpreter, or one can be found in the community. To avoid misinterpretation of questions and answers, it is important to use an interpreter who understands the healthcare system. Sometimes a family member or a friend can translate for the nurse, but such a person may be protective and not the most reliable means of transferring information. Therefore, guidelines generally discourage using family members or friends as translators. One of the most culturally variable forms of nonverbal communication is eye contact. The American dominant culture emphasizes eye contact while speaking, while many other cultures regard this behavior in different ways. So, for example, direct eye contact may be considered impolite or aggressive by many people who are Asian, Native American, Indo-Chinese, Middle Eastern, and North African. People from these groups may avert their eyes while speaking. Hispanic people may look downward in deference to age, assigned sex, social position, economic status, or authority. Muslim Arab women often indicate modesty by avoiding eye contact with men, and Hasidic Jewish men may avoid direct contact with women. When we look at space and time, personal space is the area around a person regarded as part of a person. This area is individualized to each person and to different cultures and ethnic groups, is the area to which others should not intrude during personal interactions. If others do not consider a person's personal space, that person may become uncomfortable or even angry. So when providing nursing care that involves physical contact, you should know the patient's cultural personal space preferences. For example, people from some Middle Eastern and African cultures commonly sit and stand close to one another when talking, whereas people from some Asian and European cultures may be more comfortable with more distance between themselves and others. Many people and almost all institutions in the United States value promptness and punctuality when arriving for an appointment, doing a job, or carrying out an activity. Being on time and getting to the job and getting the job done promptly are viewed as important. This is not true in some other cultures. For example, in some South Asian cultures, being late is considered a sign of respect. In addition, while some cultures are future-oriented, including activities that promote future good health, other cultures are more concerned with the present or the past. Understanding the patient's orientation to time is important as you communicate. For example, the need to be on time for appointments for healthcare procedures and when to be taking medicines. Food preferences and preparation methods are often culturally influenced. Certain food groups serve as staples of the diet based on culture and remain so even when members of the culture are living in a different country. Patients in a hospital or a long-term care setting often do not have much choice in foods. This means that people with cultural food preferences may not be able to select appealing foods and thus may be at risk for inadequate nutrition. When assessing the possible causes of a patient's decreased appetite, try to determine whether or not the problem may be related to their culture. Family support. In many cultural and ethnic groups, people have large extended families and consider the needs of any family member to be equal to or greater than their own. They may be unwilling to share private information about family members with those outside of the family. This includes healthcare providers. Other cultural groups have great respect for the elders in the family and would never consider institutional care for them. In regards to socioeconomic factors, low income is a major problem in the United States and is often described as having created a culture of poverty. Those at highest risk are children, older people, families headed by single mothers, and the future generations of those now living in poverty. Access to financial resources affects how individuals and families meet their basic needs and maintain their health. Poverty often leads to problems such as lack of health insurance, inadequate care of infants and children, lack of access to basic health care services, and homelessness. All of these are a concern to nursing. And the last influence is health disparities. The term health disparity refers to health differences between groups of people. They can affect how frequently a disease affects a group, how many people get sick, or how often the disease causes death. An example of a health disparity could be the higher rates of diabetes and heart disease among African American communities compared to other racial groups. Many different populations are affected by disparities, including racial and ethnic minorities, residents of rural areas, women, children, and older adults, and persons with disabilities. People's values and beliefs about health, illness, and healthcare are influenced by cultural, ethnic, or religious groups. Cultural influences on health and illness can include beliefs about the causes of illness, attitudes towards seeking medical care, and cultural practices related to health and wellness. For example, some cultures may believe in the use of traditional medicine or alternative therapies, while others may prioritize Western medicine. Traditional treatment options you may see include those using the use of cutaneous stimulation, therapeutic touch, acupuncture, and acupressure. Cutaneous stimulation by massage, vibration, heat, cold, or nerve stimulation reduces the intensity of the sensation of pain. Therapeutic touch is an intentional act that involves an energy transfer from the healer to the patient to stimulate the patient's own healing potential. Acupuncture, which has long been used in China, is a method of preventing, diagnosing, and treating pain and disease by inserting special needles into the body at specified locations. Acupressure involves a deep pressure massage of appropriate points of the body. Additional cultural beliefs about diet and exercise can also impact health outcomes. Providing culturally respectful nursing care means that care is planned and implemented in a way that is sensible to the needs of individuals, families, and groups from diverse populations within society. Among the elements of cultural competence are some of the things listed here. That includes developing an awareness of your own existence, sensations, thoughts, and environment to prevent them from having an undue influence on those from other backgrounds. Demonstrating knowledge and understanding of the patient's culture, health-related needs, and culturally specific meanings of health and illness. Accepting and respecting cultural differences in a manner that facilitates the patient's and family's abilities to make decisions to meet their needs and beliefs. Not assuming that the healthcare provider's beliefs and values are the same as the patient's. And resisting judgmental attitudes such as different is not as good. Being open to and comfortable with cultural encounters, and accepting responsibility for your own education and cultural competence by attending conferences, reading professional literature, and observing cultural practices. Nursing care can become complicated when the patient and the nurse have distinctly different cultural norms. Cultural imposition in healthcare is the tendency for the health personnel to impose their beliefs, practices, and values on people of other culture. Closely related to cultural imposition is ethnocentrism, which is the belief that the ideas, beliefs, and practices of one's own culture are superior to those of another culture. When health professionals assume that they have the right to make choices and decisions for patients of another culture, patients may respond in the same way that minority cultures often respond to such an attitude by the dominant culture, by becoming passive, resistive, angry, or resistant to treatment. An example of ethnocentrism would be a healthcare provider insisting that a Jehovah's Witness patient accept blood products because it is the best treatment for them, even though it goes against that patient's belief. When we talk about cultural humility, the book definition on that is recognition of diversity and power imbalances among individuals or communities, with the action of being open, self-aware, egoless, flexible, exuding respect and supportive interactions, focusing on both self and others to formulate a tailored response. Cultural humility in general is a concept that emphasizes self-reflection, openness, and willingness to learn from and engage with individuals from different cultures. It involves recognizing and challenging one's own biases and assumptions, and approaching interactions with cultural humility means acknowledging that one's own cultural perspective is not superior to others. It involves actively listening to and valuing the experiences and perspectives of individuals from different cultures and working collaboratively with them to provide culturally sensitive and appropriate care. So how do we go about caring for the diverse populations that we see? There are several recommendations to provide appropriate cultural care that we're going to talk about. The National Center for Cultural Competence urges healthcare professionals who value cultural competence to enhance their understanding by examining the following. We want to examine the beliefs, values, traditions, and practices of specific cultures, and examine culturally defined health-related needs of individuals, families, and certain communities. Examine culturally based belief systems of the etiology of illness and disease and those related to health and healing, and then look at attitudes towards seeking help from healthcare providers. The best way to do this is by conducting a cultural assessment. When caring for patients from a different culture, it is important to first ask how they want to be treated based on their values and beliefs. The primary informant should be the patient, if possible. If the patient is not able to respond to questions, a family member or a friend can be consulted. You can also anticipate a patient's cultural needs by obtaining this information through research before initiating contact with this patient. Remember, however, that information about any culture is general and that it must be individualized for specific patients once the actual interactions begin. Transcultural nursing is a field of nursing that focuses on providing culturally competent care to individuals from diverse cultural backgrounds. It involves understanding and respecting the cultural beliefs, values, and practices of patients in order to provide effective and appropriate health care. Transcultural nurses strive to bridge the cultural gap between healthcare providers and patients, promoting better communication and understanding. Before you can provide culturally competent care to patients from diverse backgrounds, you'll need to become aware of the role of culture influences your own life. Objectively examine your own beliefs, values, practices, and family experiences, as well as identify your own biases. To develop cultural self-awareness, one can engage in activities such as self-reflection, exploring one's own cultural background and biases, and seeking out opportunities to learn about and interact with people from different cultures. It can also be helpful to engage in dialogue and discussions with others about cultural diversity and to actively challenge and question one's own assumptions and beliefs. Additionally, reading books, attending cultural events, and participating in diversity training programs can also contribute to developing cultural self-awareness. You need to learn as much as possible about the belief system and practices of people in your community and of patients in the area in which you work. To develop cultural knowledge, one can engage in activities such as reading books or articles about different cultures, attending cultural events or festivals, participating in cultural exchange programs, and interacting with people from diverse cultural backgrounds. It is also important to approach these activities with an open mind and willingness to learn and understand different perspectives. Some people, especially those of minority cultures, may have been belittled or ridiculed and may be hesitant to discuss their beliefs and practices. Incorporate factors from the patient's cultural background into healthcare whenever possible if the practices would not be harmful to the patient's health. Modify care to include traditional practices and practitioners as much as possible, and be an advocate for patients from diverse cultural groups. Accommodate the cultural dietary practices of patients as much as possible. Dietary departments in many hospitals and long-term care facilities can provide meals that are consistent with special dietary practices. Families may be encouraged to bring food from home for patients with particular preferences when this practice does not violate policy. Consider the cultural role of the family member who makes the most of the important decisions. In some cultures, it is the husband or father, whereas in others it may be a grandmother or another respected elder. To disregard this person's role or to proceed with nursing care that is not approved by this person can result in conflict or in disregard for the patient's and family's values. Be careful to involve this person in the nurse care plan. Seek assistance from a respected family member, member of the clergy, or a traditional healer as appropriate so that the patient is more likely to accept healthcare services. Acknowledging the role of the person's traditional healer can be an important way to building trust. Folk medicine practitioners can work closely with professional health practitioners in the interests of the patient and family. Such efforts promote mutual understanding, respect, and cooperation.